Hi everyone, my name is Doug Myhre. I'm the Associate Dean for Distributed Learning and Rural Initiatives here at the University of Calgary. At the University of Calgary, we take a look at everything that's being done outside of the metropolitan center, including the province of Alberta, plus the Yukon and the Northwest Territories. We have 4,000 weeks of training done every year outside of the city. Rural training is not something that you can do without grassroots support. There's no way. You need to have three levels of involvement, I think, though. You might need to have the grassroots push it along and create the crisis, which we have in rural manpower and healthcare. You need to have somebody at the higher funding level, like at the government, that provides the money, because it's not cheap to do these type of events and have this type of sustainability over the years. But you also need to have that middle group of people that are willing to do the research, willing to do the design, willing to listen to all the rural practitioners about what works, what doesn't work. And I think that's what this office does. There's no doubt that our rural practitioners are fully engaged. They see the need. They are keen teachers that really want to get feedback on how they're doing, what they can do better, and how they can recruit. But they've got to have the people in my office that set it up and get the administration done and get the training done so that they can do the job that they want. We do a lot of myth busting here to try and make sure that learners realize what rural is, what the scope of practice is, what the independence is like, and kind of what the sustainability and continuity is. I think what we're most proud of at Cumming School of Medicine in Calgary is, like other faculties in Canada, we do have postgraduate family medicine programs that are based in small communities, 690 people to 80,000 people, but 2,000 is about where we're aiming for population. We have got earlier experiences for our students. We have rural experiences for all of our medical students, but the longitudinal integrated clerkship, which has grown to the point where it's now 20% of our class, is where we're getting the most bang for our buck. We're the only program in the world where the integrated clerkship finishes, you graduate, you start residency, and they're ready to go. The other thing that we've done is that we have a well-developed distance medical education network. Our LIC students, or UCLIC we call them, tie in from as far away as 2,000 kilometers annually. And so we've got a pretty well-developed system led by Dr. Wes Jackson on making sure our academics are synchronous and that the technology works well. The two programs we've got that are the newest is a pilot that we started in 2010, and we've done that in 2 courses now in our preclinical education. So the preclinical network medical education is when we take all of our early career students, we send them outside the city, and we deliver preclinical courses. Now, Calgary's course is more patient presentation, and so we'll take our students out and they'll do all of their neurology, geriatrics, and pain outside of the city. We recently published the academic results, as you expect, they're equivalent. But what we also found is there was much less social isolation in rural than there was inside the city than we expected, because they took care of each other's learning better. So we think that there's no reason to have bricks and mortar. We don't need more schools. We need to distribute people out and across the province and train them there. These learners can tell the difference between infrastructure and what happens with education. And what we've learned is, if you've got a program, don't wait until all the T's are crossed and the I's are dotted. Get them out, get their experience into rural and regional sites, and the specialties are going to start falling and going outside of the city more and more as well. So yes, we've got post-grad programs in family, we've got post-grad programs in Royal College, we've got undergrad programs, we've got integrated clerkships, we've got new ways of delivering curriculum outside the city beyond bricks and mortar, and we've got a way of supporting the doctors through our FM Pod iPad system. That means we really need to get out of the city, and we can do it right from day one. I think it's important that we look beyond our own borders whenever we have the opportunity to do so. Having this international kind of exchange at RMA, or whether you get to come back to Canada, it is really important for us to spark new ideas and understand new perspectives just so that we can keep things going a little bit better, I think.